In this lecture, we will discuss about the temporomandibular joint, its anatomy, function, and clinical relevance. What is temporomandibular joint? The temporomandibular joint is a parasynovial joint that connects the mandible to the temporal bone. The temporomandibular joint is one of the most frequently used joints in the body. What is the function of temporomandibular joint? The temporomandibular joint facilitates complex movements required for chewing, speaking, and swallowing. What are the unique features of temporomandibular joint? It acts as both a hinge joint and a gliding joint. It is one of the few synovial joints lined with fibrocartilage, instead of hyaline cartilage. Bony anatomy of the temporomandibular joint. It consists of following features of temporal bone and mandible. Temporal bone has three features involved in this joint. Mandibular fossa. It is also known as glenoid fossa. It is the depression where the mandibular condyle articulates. Articular tubercle is anterior to the fossa, providing structural support during jaw movements. Tympanic plate is posterior to the mandibular fossa, forming part of the ear structure. Mandible also has three features involved in this joint. Condyle is the rounded process of the mandible that fits into the glenoid fossa. Coronoid process is the attachment site for the temporalis muscle. Ramus of mandible supports the condyle and coronoid processes. What is the articular disc of temporomandibular joint? This is as a cushion, reducing friction between the mandibular condyle and the temporal bone. This biconcave fibrocartilaginous disc separates the temporomandibular joint into two compartments. Upper compartment is for translational movements, known as gliding. Lower compartment is for rotational movements, known as hinging. Following are the ligaments of temporomandibular joint. Capsular ligament encloses the temporomandibular joint. Lateral ligament provides lateral stability. Sphenomandibular ligament suspends the mandible. Stylomandibular ligament connects the styloid process to the mandible. Following muscles are associated with temporomandibular joint. Primary muscles include masseter muscle, temporalis muscle, medial pterygoid muscle, and lateral pterygoid muscle. Accessory muscles include suprahyoid and infrahyoid muscles. The main nerve supply of the temporomandibular joint is the auriculotemporal nerve. It is the primary innervation. It is a branch of the mandibular nerve. Now, we will discuss the last clinical topic. It is the dislocation of the temporomandibular joint. Temporomandibular joint dislocates only anteriorly. This involves anterior dislocation of the mandibular condyle. Beyond the articular tubercle, its symptoms involve inability to close the mouth and severe pain. This causes damage to lateral pterygoid. Temporomandibular joint dislocation leads to paralysis of lateral pterygoid. Lateral pterygoid paralysis will prevent the joint from going back to its normal position.